So what is the comprehensive plan? Republican governor of Ohio, John Kasich, he has not yet declared an emergency, but he has led the charge to impose stricter limits on prescriptions there for opiates, promoting rehab programs, mental health options for addicts. Today, after the president's announcement, I spoke with Tracy Plouck. She's the Ohio director of the Department of Mental Health and Addiction Services. I wanted to know, will this new declaration from President Trump help them? And what more is needed on the ground locally? How are things right now with the opioid crisis in Ohio?
In 2016, Ohio actually saw a 1,000 person increase in the number of drug overdose deaths from 2015. So our 2016 number was 4,050 deaths. We continue to struggle with this, but with that said, we believe that we have one of the most robust and comprehensive plans of intervention in the country. Governor Kasich expanded Medicaid, and more than 500,000 Ohioans have connected with addiction and mental health care as a result. We've also stood up more than 1,000 opportunities for recovery housing around the state that didn't exist several years ago. We've trained peers. We've got more programming in prisons and jails. And I feel like we're doing a lot of the right things.
You know, it seems that Governor Kasich and the administration there, that you guys were ahead of the curve in doing that with not only working this through the criminal justice system, but also through mental health and dependency issues. Do you feel like that has been critical to stopping, the quick rise that some of the other places around the country have seen?
I think we have tried to leave no stone unturned in terms of our overall interventions. We have a significant emphasis on prevention, and we've recently strengthened our prescribing requirements in Ohio to further limit the number of legally supplied pills in our state. We are continuing to chip away and examine what we could be doing more, what we need to recalibrate in our approach.
The president today announced a public health emergency nationwide. What's your reaction to the plan of action that he set out for the federal government? And, how is that going to affect localities and states like you?
But I think that, it will be informative to see to what degree states have more regulatory ability or policy opportunity, as well as financing to help move forward those interventions that are already in place or could be newly established within the state.
Many people who are dealing with opioid addiction, that they can't necessarily afford medical or rehabilitative services unless they are unless they receive benefits of Medicaid. Do you think that's going to be critical? Because it doesn't seem that that's going to really be expanded nationwide.
Yeah, if the president really wants to support forward progress with respect to the opiate epidemic, I think continuing to allow states to support their Medicaid expansions is absolutely critical.
What's the plan going forward?
I think Ohio is doing a lot of exciting work around data analytics and prescribing. Our Board of Pharmacy oversees our prescription drug monitoring program, and they are increasing their oversight to show not only individuals who may be doctor shopping, but also prescribers who may be of concern. And I think states working together across state lines can help further this work.
If you were to have a wish list and tell the federal government or anything else out there, even American citizens, here's what would most benefit us as a society when it comes to the opioid emergency, what would it be?
Quite honestly, I think that it would be more engagement at all levels of our society on prevention and wellness.